Can you all hear me? Okay, brilliant. Drug detection in urine. This is one of the themes repeatedly tested in the exams. So question number 1, how long could the drugs be detected in urine? One is amphetamines. So this particular theme is taken from this tabular column, which is in your material pack. So amphetamines could be detected in the urine for up to 48 hours. So answer for 1 is C, up to 48 hours. Question number 2, alcohol. So how long is alcohol detected in the urine? Alcohol can be detected in the urine for up to 12 hours. Okay. So question number 2, answer is A. Question number 3, benzodiazepines. So benzodiazepines could be detected in the urine for up to 3 days, and also it depends upon the half-life. So answer for 3 is D, 1 to 3 days. Next one is methadone. Question number 4 is methadone. The half-life of methadone is actually longer than heroin. Heroin is present in the urine for 1 to 3 days, but methadone is present for more than 3 days. So it's 3 days or more. So answer for 4 is E, 3 days or more. And last one is LSD. LSD is usually present for less than 24 hours. So answer for 5 is B. The other things which are tested in the exam include cannabis. Occasional use of cannabis, it can be detected in the urine up to 3 days. But if there is high daily use for long period of consumption, then it may be detected in the urine for up to 4 weeks. So question number 1, amphetamines, answer is option C, which is up to 48 hours. Question number 2, alcohol, option is A, up to 12 hours. Question number 3, benzodiazepines, option D, 1 to 3 days. Question number 4, methadone, option is E, 3 days or more. And question number 5, LSD, option is B, up to 24 hours. Next theme, Mr. X is a 27-year-old gentleman who presents with paranoia and persecutory ideas. He is drinking to self-medicate. He has some motivation to stop drinking. So what is the most important treatment option? The answer is B, olanzapine. This gentleman probably has got psychotic symptoms, which includes paranoia and persecutory ideas. Okay? And he is drinking in order to self-medicate. It's a type of maladaptive coping strategy. So in this situation, we have to treat the psychosis with antipsychotic medication. So we can mark B, olanzapine. Okay. Answer for 1 is B. Question number 2, Miss Y is a 32-year-old woman who comes in with her boyfriend. She has a long-standing history of alcohol dependence, and she's unsure if she wants to stop. So what do you do if patient is not sure? We can try motivational interviewing. Okay? So motivational interviewing is a technique aimed at enabling a patient to move through the stages of change to the point where action can be contemplated. The interviewer aims to aid the patient in explaining why they should change their behavior and how this can be achieved. So in this situation, we can try motivational interviewing. It is also helpful to explore and resolve ambivalence about behavioral change. So question number 2, the correct answer is G, motivational interviewing. Question number 3. Mr. Z is a 35-year-old gentleman who has been abstinent for 3 months and wants to continue remaining abstinent. So which one would you use for long-term maintenance? It's disulfiram. Okay, disulfiram should be tried. Okay, disulfiram can act as an adjunct to alcohol detoxification therapy, and it allows the patient's relatives to regain confidence in their ability to remain abstinent. So answer for 3 would be E, disulfiram. It's more effective. Disulfiram is more effective than acamprosate. Okay, so if both options are given, I would mark acamprosate. Question number 4. Mr. P is a 55-year-old man with alcohol dependence who has had inpatient detoxification and is motivated to stay dry. He has history of ischemic heart disease, diabetes, and hypertension. He is keen to have a medication as an adjunct to counseling. So which one would you use? In this situation, we can try acamprosate. Okay? Acamprosate could be tried for patients who wish to remain abstinent from alcohol. Disulfiram is contraindicated in patients who have hypertension, coronary artery disease. So in all these situations, disulfiram is contraindicated. So we can try acamprosate as an adjunct to counseling. So answer for 4 is D, acamprosate. Question number 5. Mr. Q is taking a medication for sleeplessness prescribed by the GP. He has read that this drug has a dangerous interaction with alcohol. Identify the drug. Okay. Interaction with alcohol, it's chlormethiazole. Chlormethiazole can cause respiratory depression. Okay. And if taken along with alcohol, it can cause severe respiratory depression and it could be fatal. Therefore, it should not be used. So question number 5, answer is I. Next theme, it's about stages of change. Prochaska and DeClement's model, they suggested stages of change, and questions come from this particular theme repeatedly in the exams. Okay. Let's look at the stages of change. First one is pre-contemplation stage. The person is not even ready to think about change seriously. Second important stage is contemplation stage. The person is ready to think about change. They look at positive and also negative aspects. The third stage is called as determination stage or preparation stage or ready for action stage. Here, the person is preparing to make plans for change. They also involve in goal setting and self-evaluation. The fourth stage is actually implementing some change. And last one is maintenance stage, ensuring that the change in behavior becomes habitual. These are the different stages of change. Now let's try to solve the questions. Question number 1. Mr. T has 2 ways about making change. However, he has started appreciating the costs and benefits of the behavior. So which stage he is in now? He is in contemplation stage. Okay. In the contemplation stage, the user may accept that there is a problem and they begin to look at the positive and negative aspects of continued drug use. Okay. They're looking at the costs and benefits they appreciate the costs and benefits of the behavior, look at the positive and negative aspects. So that is contemplation stage. So answer for 1 is G. Question number 2. This is the final stage in the process of change in successful patients that continues lifelong. This one is I, maintenance stage. Okay. So in maintenance, the person has been able to sustain the change. In successful patients, this usually is the last stage that continues lifelong. Question number 3. Mr. P is content with his own behavior and is unlikely to express any need for change. He is not recognizing that the substance was contributing to his problems. Okay. So this is pre-contemplation stage. Answer is J. Okay. In the pre-contemplation stage, the person is not even considering change in his or her behavior. They don't see the behavior as a problem. They try to either minimize a problem or they try to deny. So answer for 3 is J. Question number 4. Mr. Q makes an initial attempt at modifying their behavior, which is problematic. So what is this? This is action stage. So here in action stage, the person has implemented a plan and is changing the behavior. This is the point of motivation where the user attempts change. So answer for 4 is F, action stage. Question number 5. Mr. Z plans behavioral change by setting clear goals. He also assesses past achievements and failures in his life. So what stage is this? Good. This is ready for action stage. In the ready for action stage, the person is preparing to make plans for change. It involves planning, preparing, goal setting, as well as self-evaluation of past achievements and failures in their life. So answer for question number 5 is C, ready for action stage. Next theme, intoxication and withdrawal syndromes. Question number 1, a 23-year-old man who has got vivid, unpleasant dreams and also increased appetite. So choose the option. This man is having amphetamine withdrawal. Okay. So when there is amphetamine intoxication, the person may have insomnia and also poor appetite. But when there is amphetamine withdrawal, it's the opposite effect, where they have increased appetite, they also have hypersomnia, and also vivid, unpleasant dreams. That's a characteristic feature of amphetamine withdrawal. So answer for 1 is E. Question number 2. A 27-year-old woman with pupillary dilatation, yawning, and nausea. So what is this? These are all features of opioid withdrawal. The answer is H, opioid withdrawal. Okay. So when they withdraw from opium, they have all these features. The main important features include lacrimation, nausea and vomiting, rhinorrhea, pupillary dilatation, piloerection, and goose flesh. All these are important features of opioid withdrawal. So answer for 2 is H. Question number 3. A 19-year-old man with nystagmus, slurred speech, incoordination of movements. You have to choose 2 answers. Okay. So these are all features of benzodiazepine intoxication and also inhalant intoxication. So when there is severe intoxication of benzodiazepines and also inhalants, the person can present with dizziness, nystagmus, unsteadiness of gait, slurred speech, incoordination of movements, etc. So answer for 3 is A and B. A is benzodiazepine intoxication and B is inhalant intoxication. So A is benzodiazepine intoxication, B is inhalant intoxication. Question number 4. A 20-year-old woman with pupillary dilatation, nausea, and seizures. These are all features of severe amphetamine intoxication. So there is severe amphetamine intoxication. The person can present with pupillary dilatation. Okay? They can develop cardiac complications in the form of chest pain, cardiac arrhythmias. They can develop respiratory depression, and they can also develop CNS complications in the form of seizures, confusion, and coma. Okay? So answer for 4 is J, amphetamine intoxication. Question number 5. A 23-year-old man with dysphoric mood, hypersomnia, and intense craving. So intense craving is an important feature of cocaine withdrawal. So in this cocaine withdrawal, the person may have intense craving without physical withdrawal symptoms. They may have irritability, dysphoric mood, as well as anxiety. Okay. So answer for 5 is C, cocaine withdrawal. So question number 4, the answer is J, amphetamine intoxication. Question number 5, the correct answer is C, cocaine withdrawal. Next one is neonatal drug effects. Question number 1, newborn baby with low birth weight, small head circumference, and dysmorphic facial features. So newborn baby with low birth weight, small head circumference, and dysmorphic features. What is the answer? These are all features of fetal alcohol syndrome. Okay? In fetal alcohol syndrome, the person may have intellectual impairment. The newborn child may have learning disabilities. They may have dysmorphic facial features, okay? Low birth weight, small head circumference, and also destructive behavior. Okay? So answer for 1 is C, fetal alcohol syndrome. So this child has got low birth weight, small head circumference, and dysmorphic facial features. Question number 2, newborn baby who is very irritable, high-pitched cry, cries a lot with shakiness, poor feeding, sleep-wake abnormalities, and vomiting. Okay. So hyper-irritability and high-pitched cry, these are all 2 important characteristic features of opioid withdrawal. Okay. So in terms of neonatal effects of opioid withdrawal, they will have hyperirritability and high-pitched cry. The baby may also have tremors and also jittery movements. Feeding is generally poor, and neonatal reflexes are exaggerated. Exaggerated neonatal reflexes, another important feature of opioid withdrawal. So answer for 2 is D. Question number 3, newborn shows mild tremors, intermittent irritability, and increased need for handling. Neonatal reflexes are normal. So what is this? These are all features of nicotine. Okay. So in nicotine withdrawal, the baby may show signs such as fine tremors. They may also have subtle neonatal behaviors, which includes increased need for handling. Okay. But neonatal reflexes are usually normal in nicotine withdrawal. The neonatal reflexes are exaggerated in opioid withdrawal, but in nicotine withdrawal, it is normal. So question number 3, the correct answer is E. Question number 4, newborn baby with low birth weight, breathing difficulties, floppy muscles, and irritability. Okay. So what is this? These are all features of floppy baby syndrome due to benzodiazepines. Okay. When mothers take benzodiazepine during pregnancy, when their babies are exposed, they develop floppy baby syndrome, which includes low birth weight. The child may have breathing difficulties, and they may have floppy muscles. In extreme cases, they can develop convulsions. Okay. So answer for 4 is B, floppy baby syndrome. Flumazenil is a drug which can be used to reverse most of the above effects. So question number 1, option is C, which is fetal alcohol syndrome. Question number 2, the correct answer is D, opioid withdrawal. Question number 3, the answer is E, which is nicotine withdrawal. And question number 4, the correct answer is B, floppy baby syndrome. Okay. So we've come to the end of the addiction section, and I'm going to pass it on to Dr. Lena to continue with the critical appraisal topics. Thank you.
Hi, folks. Can you hear me? Good. Good morning. So we're going to move on to critical appraisal. I want to do some of the most challenging topics in the morning to start with, when your attention is full and sustained. So let's start with the advanced statistics. So yesterday we saw um, evidence-based medicine. We saw part of it. We saw how to appraise a diagnostic test. I talked about sensitivity, specificity. I haven't done correlation, other scatter plots and other graphs yet, which I will do later today, just after lunch. That's a little easier part, so it's better to do it after lunch. But in the morning, I'm going to start with some statistics concepts, things like data, types of data, different statistical tests, and things like that. So some of you say you can't hear, no audio. Wait a minute. Okay. Can you hear me now? Yeah, okay. Good. Fantastic. Right. So let me start with first chapter in our question book, which is advanced statistics. So it's page number 1, page number 2, actually. Just keep page number 2 up. Like yesterday, I will be starting with some concepts, teach the concepts before we move to the question book. Okay. So if you're ready, we'll start. Everybody is able to hear me, Lane. If you can't hear, just try and see if your speakers are working. Okay. So right now, I'm going to move to the recorded video of advanced statistics.